Hey, Dr. Tyler Williams here with Pinecrest Dental, and you probably found this video because you're experiencing tooth sensitivity, or maybe you recently had some dental work done and a crown or a root canal still hurts when you bite down, or cold or hot bother it, or maybe it's just that dull nagging ache that's there all of the time and it just simply won't go away. So there are a number of things that cause tooth sensitivity. But the main reason is that some part inside of your tooth is exposed. So in the case of a crack or a cavity or receding gums, something inside your tooth is exposed to your mouth and to food and to hot and cold, and so it's uncomfortable and it hurts. And I know personally, because I dealt with tooth sensitivity for many years, from some receding gum issues that I've had, and I've had several surgeries to get those fixed, and so I really like to help our patients avoid that and share these videos with you to help you get through tooth sensitivity, because you're probably feeling like it's just nagging and sometimes you can deal with it, but then there are days where it just won't stop and it gets really annoying and frustrating. So in the case you had dental work done, what that means is that there's some part of your tooth that maybe wasn't sealed properly, or maybe the work that was done was too aggressive, which is one we commonly see. A very common one the patients come to see us for is they had a crown done somewhere else, and when they bite down it hurts, or it feels very bulky or large, or they've gone in a dozen or so times and somebody's ground down on that crown and it's still too tall and it's not comfortable. So the good news is, going forward, you have some better options, and we've shared in some of our other videos about biomimetic dentistry, how there's a better way to have your teeth bonded and sealed and not drilled down to crowns, and you're 3 times less likely to need a root canal when you have dentistry done this way. And that's the way that I treat my own family members, treat patients. We almost never do crowns in our office unless, of course, you already have a crown and it broke, and sometimes that's the only option we have. But implants are great. It's typically better to keep your natural tooth, because we can make your real tooth look like an implant or look like a veneer with new bonding and ceramics. And when you have your teeth treated with the biomimetic way, it's a lot more comfortable. And we have a concept that we call Prism that we've developed and that we utilize in the office here. And Prism is the protocol we use so that you get a beautiful shiny tooth that also functions well and feels comfortable and lasts a long time and is incredibly strong, and typically are stronger than crowns. Sometimes people ask us, hey, with getting an overlay or partial ceramic cap, why not just do a full crown? Isn't that stronger? And it actually isn't, because when you do a full crown, you have to cut away all the enamel off your tooth, and that is the hardest, strongest material in your body. It's harder and stronger than bone. So we want to keep all of that enamel, because it will actually bond to your overlay, and it's much stronger and less sensitivity, and it's amazing, patient after patient, how they get used to these overlays so much faster when they're bonded, so much less sensitivity, because of the steps we use in our Prism bonding system, and the ability to chew and eat more naturally, and the tooth feels nice and smooth and you don't have that bulky tooth. So if you're experiencing tooth sensitivity and you have more questions besides what we've gone through in this video, feel free to give us a call. We have a book that talks all about this, and we have a few extra copies. We'd be happy to share one with you, and just give us your name and email and we can send that your way. So thanks for watching, and we'll see you on the next one.